Alrighty. So a little bit about what we do. So Matters program efficiently links individuals with opioid use disorder to treatment. So we offer this referral can happen 24/7, 365 days a year. And this supports patients to be able to get treatment in their community. We also offer harm reduction materials that Shelby will get into a little bit later. So how it works is that originally it started with two emergency room physicians. They were in Buffalo, New York, and they had a huge population of patients who were presenting to the emergency department with either an acute withdrawal or post overdose. And these patients really needed to be connected to outpatient care or medication assisted treatment immediately. But at the time, there wasn't an easy way to do this. So patients were either given a list of phone numbers or doctors were spending hours on the phone, not being able to reach individuals or clinics to connect these individuals to treatment. So because of this is where the two doctors came up with the idea of the electronic referral platform. So today, we don't just partner with emergency departments. If you could see on this slide, we do partner with other entities. And really all that Matters wants to do is to connect patients to care. And basically any location where there's an interaction with a person with opioid use disorder, those are places that we want to partner with and offer this resource. So our goals during each encounter are to make that rapid referral. We really want to minimize that window of time from when the patient is seen to when they are cared for. So no phone calls. We want to be able to put that through, and the referral process really does take less than 5 minutes. So it's quick and efficient. And connect individuals to appropriate treatment within their community. We want to make sure that individuals that are presenting with opioid use disorder aren't only getting care for opioid use disorder. So if an individual has other problems, we want to be able to connect them to a facility that offers care for those as well. Also, if an individual needs immediate treatment, we do offer telemedicine we do offer telemedicine services, and this is a way to connect the individual immediately so that they can receive an evaluation from a provider to assess eligibility for a bridge prescription, which the bridge prescription would then hold them over ideally until they were able to be seen by the clinic of their choice. So this is a map showing our current partners right now in New York State, just to give you a little bit of an idea of where we are. We are constantly onboarding and hoping to expand. And right now, our main goal is to hope to expand to neighboring states. Our mission is really to provide everyone with multiple pathways to treatment. With clinics, when we onboard them, we make sure that they must be willing to accept patients that are referred to them, regardless of insurance or polysubstance use. And we really want to work with patients to get them set up with appropriate treatment plans. Our vision is to hopefully expand and be utilized across the US and reduce the morbidity and mortality rates for people living with substance use. And then here are some of our values. We will always link individuals to services and resources, no matter what step they are ready to take. Speak up and support and defend those who need help. Be honest and reliable. Be determined to reach the unreachable and overcome obstacles. Make prevention and treatment information readily available so that when those who choose to take action can do so with knowledge and understanding. Continue to build an extensive network with efficient referral process in order to help those who need it, and provide an environment that is free from stigma and judgment and inclusive and respectful of all. So we do have an app as well, just another way to access our referral platform. You can either download the app or go on www.mattersnetwork.com referrals.org. And in addition to referral, we have a bunch of educational materials, videos. You can request xylazine and fentanyl test strips, which Shelly will talk a little bit more about later on. And there's a bunch of different other educational materials. So definitely take a look at that. Here's a little synopsis of what our app looks like when you first log on. So it kind of breaks it down by who is looking at the app and then what services we provide according to that. So some of the frequently asked questions we get are, how many times can an individual be referred? So there really isn't a limit. An individual can be referred as many times as they need. And the goal is from when the patient is seen, we want to be able to get them into an appointment within the week of them being seen. Ideally, it would be nice to have them be seen as soon as the next business day. But we partner with different organizations to get their appointment availability and try and minimize that window, as I mentioned earlier. So when the referral process is, when you go through the referral process with the individual, the exact time of the appointment is actually not selected. The date is, and the appointment is, or the day is in the facility, but we found it best for both patients and the clinics to determine a time together, just because it allows for flexibility. And then it also kind of gives the individual the power to take control of their treatment and see what works best for their schedule. So telemedicine is a huge asset of the Matters referral platform. When an individual presents, and as I mentioned previously, if they need medication immediately, we recommend directing them to our telemedicine services where they can be quickly evaluated by a prescriber. And if deemed necessary, they are able to receive a bridge prescription if appropriate. So we also, for individuals who have no insurance or are underinsured, we offer medication vouchers. So this is a one-time for the first time that they present. It covers up to 14 days of the cost of the medication. So that is just another way we are trying to overcome some of the obstacles that we have realized our individuals have been experiencing. So our medication vouchers are accepted at the following pharmacies. And then we also have a list of independent smaller pharmacies throughout the state that are on our website, as well as on the printout voucher that they opt into when they go through the referral process. Another thing that we do is we partner with Uber Health, which is our transportation. We provide a free ride to and from the individual's first clinic appointment. So another way that we're trying to overcome some barriers is just be able to get that individual to their first appointment. And they can opt in through the referral process if they do need a ride. So some of our current harm reduction strategies that Shelby will go a little bit more into, we are distributing xylazine test strips, fentanyl test strips, and naloxone. And we are going to be rolling out later on this year 15 harm reduction vending machines across New York State. These are going to have Narcan and test strips available for individuals. So here's just a little synopsis of what we've done so far. This number is probably a lot higher actually as of this past week. We are constantly shipping out test strips daily. And so we've reached over 1 million test strips distributed to organizations as of the end of June, and over 15,000 to individuals. So here is another important aspect, as I mentioned, telemedicine. And as you can see, just the jump in how much it's been utilized from 2019 up until 2023, and we're only halfway through the year. So we expect those numbers to continue to rise as well. And then here's a little bit of what we did last year. So it just kind of shows how we have grown in the past year. We've made over 1,000 referrals, and to date we have over 2,500. So we are continuing to grow, and we are really excited for anyone that wants to come along on the journey with us. So if there's any questions, I think we're going to do a little Q&A at the end. So please feel free to either pop them in the chat or pull them off for later. Thank you.
Awesome. I will share my screen and get my presentation going. Bridget, can you stop sharing? Thank you. Awesome. So like I said, my name is Shelby Arena. I am the harm reduction coordinator here at Matters. I'm going to talk a little bit just about the general principles of harm reduction, a little bit about the history, some of the substances that we're seeing infiltrating the drug supply, and then we'll definitely have time for some questions and answers. So harm reduction is something that we see in our everyday lives. I just think, we're not as familiar with the term harm reduction. So, riding in a car, it's not the most safe thing that we can do, but we're not going to completely stop using cars. We're not going to completely stop riding bikes or going out in the sun, but there are different tools that we can use to mitigate the negative consequences of engaging in those risky behaviors. And so in terms of substance use, when we talk about harm reduction, something that's really important to note is that just because someone uses a substance does not mean that they have a substance use disorder. And so, according to this, 90% of people who use drugs don't meet the criteria for a substance use disorder. So we like to talk about the continuum of substance use. You have folks who have never used at all or identify as abstinent. Some people who use experimentally, maybe on the weekends, recreationally. And then once we get towards this other end of misuse, problematic use, and chaotic use, that's where we do, see people who may or may not qualify for some type of diagnosis. But when we're talking about harm reduction, especially in the lens of stigma, we really want to keep in mind that not everyone who uses a drug or a substance is someone who qualifies for a substance use disorder. And when we talk about people who have substance use disorder, who are, thinking about engaging in treatment, we like to use the trans-theoretical model of behavior change. And the way that the harm reduction program came to Matters, like Bridget said, we started out as the electronic referral platform for folks who were looking to engage in treatment. But we also recognize that not everyone who uses substances is ready to engage in treatment or might not ever want to engage in treatment. Some folks are in the pre-contemplation stage. They have no intention of changing their behavior. They might be thinking about it in the contemplation stage, have an idea that maybe something, they're not comfortable with certain aspects of their lifestyle. They might want to consider, engaging in treatment. And so the reason we have our harm reduction services is because, those folks need support. They deserve to have autonomy in their lives. They deserve to be able to engage in whatever behaviors they wish to in a safe, less risk environment. And so, we use this model, and, we work with folks who are at any stage of the, behavior change cycle. Something that, we really like to highlight in this model is that relapse is part of the process. So, I think some folks, once they engage in treatment, maybe they get to a good point where they're not using anymore, they think they're done. The process is over and they can just kind of coast for the rest of their lives. Unfortunately, it's not that easy. Maintenance is sustaining that change. It does take effort and action and behavior. And there's always that potential for a relapse. And just because someone relapses doesn't mean that they've fallen out of this circle completely. And so we like to actually think of it more as a spiral than a circle. So it's not like someone's just repeating the same patterns over and over again. It's an upward spiral where they learn something from each relapse. So, next time they jump back into this spiral, they'll have already done some of the preparation that they did last time. They don't have to look for a clinic. They're aware of what their insurance is. So each time it does get a little bit easier. But again, the reason we fall back onto this model is because anyone at any point in this cycle, deserves support. So in the context of harm reduction in substance use, a lot of it is, or at least a lot of what we focus on here at Matters, are opioids. I'm sure a lot of you are familiar with opioids. They're natural or synthetic substances that act on the brain, used to treat severe pain. They can be used illicitly, but they're also prescribed and can be very safe in a medically controlled environment. But they are extremely risky because they can be addictive, and taking too many can lead to overdose and death. And so I'm sure a lot of you have heard about fentanyl. Fentanyl is a synthetic substance, synthetic opioid that has been mixed into the drug supply, mostly into heroin, but it is found in other drugs. Usually it's added into the drug supply before it reaches street dealers. This is important to note. We like to share this because I know a lot of folks maybe have either experience a client loss or a loved one, someone in the community. Unfortunately, substance use and overdose deaths affect everyone. And when that happens, I know a lot of times folks kind of go to the person who gave them that substance and say, why did you sell, my friend fentanyl? And for the most part, that person probably doesn't know that there's fentanyl in the drug supply. So that's why utilizing test strips are super important and can be super beneficial in terms of addressing overdose deaths. Another thing we like to touch on is that you can't overdose simply by touching powdered fentanyl. That's a myth. I know we see a lot of that perpetuated in the media. And, we don't say this, just to talk down on people who maybe are perpetuating this myth, but because this is such a commonly held belief, people think that maybe if someone is overdosing on fentanyl and there's fentanyl on the table, they think they might overdose just by being in the same room as fentanyl, and that's not the case. So if someone that is overdosing, don't be afraid to go in and to administer that naloxone, because you can't overdose just by being in the same room as powdered fentanyl. So we talked a little bit about this. Medical fentanyl is something that's extremely safe. There are safety precautions in place when it is prescribed by, under medical supervision, and it has a lot less side effects than other opioids. So it is the preferred pain medication in most medical settings. Versus street fentanyl, there really aren't any safety precautions. It's often concentrated doses, or you don't really know what the dose is. And then it's often contaminated with other substances. And most recently, Xylazine is what we're seeing mixed in with fentanyl. And we'll talk a little bit more about Xylazine next. And so fentanyl is extremely potent. These small amounts here are enough to be lethal and cause a deadly overdose. So that's why it is really important that we have this education on fentanyl, and we do provide testing strips so folks can make an informed decision when they are using substances. This is a little more specific to our county, so I will kind of skip that, but you can see that overdose deaths have been on the rise steadily since 2012. There was some legislation in 2017 that really drove overdose deaths down, but then you can see here in 2019, after the pandemic, folks were isolated. It was hard to get in touch with resources and treatment organizations, and that really we really saw the overdose deaths begin to spike again. So Xylazine. Xylazine is a drug that we're seeing infiltrate the drug supply right now. It's also known as tranq or tranquilizer. It was developed, began its development process as a human medication for antihypertensive. The trials were stopped pretty quickly because it caused central nervous system depression and the lowering of blood pressure. So the trials switched over to veterinary use, and it was FDA approved for veterinary use as a sedative and a tranquilizer. And the reason that we see that it's added into the drug supply is, we'll talk a little bit about this later when we get into the history of harm reduction. But there's kind of like three waves of the opioid crisis. The first was that, prescription pill wave that started in the late 90s, early 2000s. Once that kind of, the FDA and other organizations kind of crack down on that, we started to see fentanyl infiltrate the drug supply, which is the second wave. Or I'm sorry, they moved to heroin, and then fentanyl was the third wave. Heroin is something that's really expensive to produce. It's a natural product. It's grown from poppy flowers, so it takes a lot of money and manpower to produce heroin. You have to have the fields, you have to have laborers to harvest it, process it, all that good stuff. So that's when fentanyl, is a synthetic product made in a lab. That was, just you get more bang for your buck by adding fentanyl into the drug supply. The big difference, though, is when you use heroin, it has a much longer period of euphoria. So fentanyl had probably around half of that period of euphoria. So by adding xylazine into the mix, it extends that period of euphoria, almost meets it back up to where heroin was. And so that's kind of the reason we think why we're seeing it added into the drug supply. The thing is with xylazine, it's not an opioid, so it does not respond to naloxone or Narcan. And we are seeing an increase in fentanyl and xylazine combined overdose deaths. Another thing is the skin wounds. It does cause some pretty severe skin wounds. These wounds can appear, they're on the limbs, and it is not associated with the site of injection. So if someone is, an IV drug user that injects in their arm, they could still get these wounds appearing on their legs. Or if there's someone who smokes or snorts their substance, they can still get these skin wounds. And we'll talk a little bit more about those later. The reason that it's so hard to address is because it's something that's rapidly changing. So you can see here in 2020, in the South, there was only 116 xylazine related overdose deaths. A year later, it increased by over 1,000%. So this is something that's, rapidly infiltrating the drug supply. And, it is pretty new to us outside of folks in Puerto Rico, and it has been an issue in Philadelphia for a while. But we're really still trying to get a grasp on it, really trying to get more information and to learn the best practices and how to address it. And so we talked a little bit about those skin wounds. We do want to show a photo of what the skin wounds look like. And this isn't for the shock factor. It's really because people don't know a lot about them. And like I said, they're appearing in different places that are not associated with the injection site. So a lot of times when you're working with folks, especially folks who have poor connectivity to healthcare services, and you're asking them how they're doing, especially related to their drug use, this isn't something that they are apt to associate with their drug use, so they might not bring it up to you. So it's important really to get the education out there about these skin wounds. We are also finding that because xylazine, it does extend that period of euphoria. Initially it makes people feel really good and they might be seeking out substances that contain xylazine. But then a lot of times once they hear about these skin wounds or start getting these skin wounds, it really is a big deterrent to avoid xylazine, start using those test strips and, take further harm reduction measures. So I'm going to move on to the next slide. If you are sensitive, don't want to see it, close your eyes. I will let you know when we've moved away. And so these are some photos of the skin wounds that are common with xylazine. They progress pretty rapidly. They are not easy to treat. They are not responding as well to traditional wound care methods. And they are, they can lead to sepsis, amputation, and even death. There's evidence that folks have been dying just from the skin wounds, not from a xylazine overdose or xylazine poisoning, but from the skin wounds themselves. So it's a really big issue, and it's something that this piece of the xylazine education has shown to be the most impactful. Okay, so I moved off the skin wounds if anybody was looking away. And so we talked a little bit about this already. Xylazine was present in the Philadelphia, Camden, New Jersey area starting around 2006. And xylazine, honestly, it's been present in the drug supply for a long time, but in much, much smaller doses. And then between 2015 and 2020, it really ramped up in the Philadelphia area. It's becoming more prevalent in New York. Some of the folks from the Matters team, we had the opportunity to go to On Point in New York City. I'm not sure if anyone's familiar, but that was around May. And they utilize xylazine test strips. They also have the Department of Health come in with the mass spectrometer machine, which also, tests for not only the presence of a substance, but the potency. And, they said they hadn't seen too much of it. It was, it was showing up, but it wasn't a huge problem yet. That was in May. I talked to the folks there last month, and they said it's a completely different story. It's already becoming a much, much bigger issue just in that short period of like a month and a half. So it really is a rapidly growing problem. Another aspect of the xylazine issue is that it is an FDA approved veterinary medicine. So that just means it's a lot easier to obtain. We're hearing anecdotes of folks being able to get it off these black market websites. There is some veterinary diversion going on. Originally, we thought that it was mostly coming from inside the US, but now we're seeing some evidence that it might mostly be coming from outside the US. And that just goes to show how new of an issue it is and how much we really don't know. So that was our piece on xylazine, and we'll definitely be able to take some questions on that a little later. Now, I just want to quickly talk about the history of harm reduction and some of the different methods that folks use and things that we can look forward to in the future. So harm reduction really started out of the social movements of the 60s and 70s. The Black Panther Party, they're explicitly demanding free healthcare. The Young Lords also had demands for healthcare, treatment for addiction, prevention programs. ACT UP was specifically for, HIV and AIDS prevention. And ACT UP is where we really started to see the beginning of the drug user health movement as well. And so in the 80s, we started to see syringe exchange programs pop up, started first in Europe. And then Edith Springer, she is kind of credited as being the co-founder of the American harm reduction movement. She, went and visited those syringe exchange programs and came and brought them back to the US, starting in New York City and Seattle. They were syringe exchange programs, meaning they were one-to-one programs where you would get one syringe if you returned one syringe. Now we're kind of moving away from those where, you don't have to return anything in order to get the supplies that you need, which is really just helping to reduce the barriers and increase access. And so this third point of the harm reduction movement is really where Europe and the US start to diverge. In the late 80s, we saw safe consumption sites pop up across Europe. These are places where you can go and consume substances under the supervision of folks who are trained in overdose prevention. A lot of these places will have drug testing kits. We just talked about On Point. On Point had been operating kind of under the radar as a safe consumption site for a while. But in 2022, it was officially sanctioned by the mayor of New York City. Unfortunately, safe consumption sites are federally illegal. So it was really the mayor of New York City saying, we're not going to bother you, we'll allow this to happen. But that's why it's been so difficult for other places to start safe consumption sites in the US, because it is federally illegal. The next major piece of the harm reduction movement was the legalization of naloxone for non-medical persons. We saw this in the beginning of the 2000s. It hit New York State in 2006. And even when it was legalized for non-medical persons, it still wasn't easily accessible. But now, here in 2023, hopefully in your area, I know in our area, it's really accessible to get naloxone. You can text a number. Even if you don't have a local organization near to you, Next Distro does mail order naloxone across the state. So that's always a great resource. And then the last piece I like to talk about are Good Samaritan laws. And Good Samaritan laws are laws that protect a person who's overdosing and anyone who witnesses an overdose or calls 911 in response to an overdose from certain legal consequences. So if there's, a felony level of possession, or, there's a violation of probation, parole, warrants, that kind of stuff, unfortunately, you're not protected. But if it's a smaller amount of drugs, if there's underage drinking involved, different misdemeanor level offenses, you are protected. And so these laws really encourage folks to call 911 at the scene of an overdose. And so when we talk about harm reduction, there are certain principles that are really fundamental to the movement. Participant-centered services really just means that we are going at this from a place of non-judgment and non-coercion when we're providing these services. Participant involvement ensures that participants have a real voice in the creation of the programs and policies that are designed to serve them. Participant autonomy, it affirms people who use drugs as their own primary agents of change. A lot of times something we hear in the movement is nothing about us without us. And then pragmatism and realism. This is really important because the harm reduction movement gets a lot of criticism saying that, maybe we're enabling folks to use drugs. And pragmatism and realism is a foundational aspect of harm reduction. Harm reduction does not minimize or ignore the harms and dangers associated with drug use. We just want to provide autonomy and support to folks who do engage in those behaviors. Culturally informed, we want to recognize the various social inequities that affect people's vulnerability to deal with potential harm. And then finally, health and dignity just establishes the quality of the individual and community life and well-being as the criteria for successful intervention and policies. And so these are some current harm reduction strategies outside of kind of the basics that we talked about in the timeline. Overdose prevention, that's, understanding what puts someone at risk for overdose, knowing the signs of an overdose, the Good Samaritan laws we talked about, and then naloxone training and distribution. Safer drug use, this kind of goes into our drug testing strips that we supply, but also is a lot about education. We encourage folks to use slow, use a smaller amount. You can always use more if you need to, use together. And that doesn't mean using at the same time. One person can use first, observe the other person, make sure they're okay. Always have naloxone available when you're doing this. And then the other person can use so they can watch out for each other. And then testing your supply. So you have, you're armed with all the tools to make a safe decision and the best decision for you. Then we have syringe exchange programs. We talked a little bit about those as well. Beyond providing syringes and works, they also provide community support and linkage and referrals to outside programs. So these are really important to community level health. They connect folks to Hep C and HIV treatment, housing, primary care, and then also to addiction medicine. So that leads us to the medication for opioid use disorder. And so that's kind of where the foundation of Matters is and what Bridget talked about a little bit earlier. And so we talked about what we do at Matters. Bridget touched on MOUD, so I won't go over that again. We have our harm reduction vending machines that are rolling out. We are trying to get them equally distributed across the state. So hopefully there's one in your area. We do have one opening left if anyone is interested in a harm reduction vending machine. We are trying to move the process along pretty quickly, but if you have a location you'd like to sponsor a vending machine, I'd love to chat with you. And then the last piece we like to talk about in terms of harm reduction is person-centered language. And so from studies, it shows that stigma is the #1 barrier to accessing care. Beyond insurance, beyond transportation, finances, anything, it's stigma. People don't want to go to seek help if they feel like they're going to be judged or talked down upon. And so one way to mitigate that is to use person-centered language. We don't want to use terms like drug addict or user. We always want to start with a person. They're a person who uses drugs. Over here, we have this language guide that's attached. It's from Shatterproof. It's a really great resource that goes through all these different terms, why they may be stigmatizing. A lot of them that I didn't even know, were not the best term to use. So that's a really great resource. We will be sending out the slides after this, so I recommend going through that on your own time as well. And then the last piece is the future of harm reduction. We talked about safe consumption sites. We do have one in New York City, but I really think every city needs one. So that's something that, we're really pushing towards. And then taking that one step further is safer supply. And that means providing a prescribed medication as a safer alternative to drugs that are, bought on the street to people who are at high risk of overdose. And so this is something that is already happening in Vancouver. There are a couple of clinics that provide prescription opioids to folks who have opioid use disorder. And it's shown to be very successful because they know exactly what's in the supply, they know exactly how much they're getting, and they're taking it under medical supervision. I don't unfortunately see this happening in the US anytime soon, but just having these conversations, learning about what's out there is always taking us one step closer. And then, we love harm reduction because it is supporting individuals and in being autonomous and making their own decision, giving them their agency back. But we know in terms of our funders, I know we have a lot of nonprofits on the call. Most people are probably grant funded. Those funders really want to see how we're saving money. And so not only is harm reduction, empowering folks to make safe decisions, but it also is cost effective. So it helps reduce HIV transmission and increase access to other supportive services. They have in safe injection facilities have increased enrollment in detox. And a big criticism of safe injection facilities that people in the community share is that they're concerned it's going to bring more drug users into a neighborhood or to increase social disorder, increase crime. And the studies have shown that that just isn't the case. And then I'm sure you guys know about this better than anyone else, but Housing First programs also reduce the medical and social care costs in clinical outcomes for folks living with HIV and AIDS. So really, harm reduction is a win-win overall. The last thing are just some questions to think about in ways to reduce stigma. Are you using person-first language? Are you mixing up substance use and substance use disorder? Are you using sensational or fear-based language? We always try to use technical language with a single meaning. And, are you perpetuating any of these drug-related moral panics? When you see these articles or these stories shared on social media, are you questioning them? Or are you sharing them? So these are just ways, some tangible ways for us to address stigma in our own client or patient care. So we offer Narcan training. You can always order test strips through us, and then you can learn more about becoming a referral partner, and Bridget can talk more about that. These are just some resources that are always interesting to look at. This is a YouTube video about OnPoint and the clinic in Vancouver. So this is a really great introduction into those last two pieces that I highlighted as the future of harm reduction. And then these are just some articles talking about the impacts of stigmatizing language on health outcomes. And that is the end of our presentation. So I will stop my share and we can open up the Q&A. So I see Willow asked, I know this isn't relevant just yet, but is there anything that can be done with expired fentanyl test strips? We have a lot that expired at the end of June. We'd love to have a use for them instead of just throwing them away. That's a great answer or great question. I'm not exactly sure. I know with a lot of test kits, even medications, Narcan, expiration dates are kind of arbitrary. That being said, if you have access to ones that aren't expired, we always recommend using those. I can reach out to BTNX. They're our manufacturer of the test strips and get a more concrete answer for you, and I can follow up with you on that. What was the legislation in 2017 that helped? I don't have the specific name of it off the top of my head. I probably should include that in my presentation, but that was in addressing the pharmaceutical companies. Right now we are finally starting to see funds from the opioid settlements. And so that's when that whole legal process started in 2017, where we really started to see a crackdown on the prescription opioid medications. And Eve, regarding the skin wounds, does risk of skin wounds increase with muscling skin popping as opposed to IV? Why does xylazine cause the skin wounds? So the risk of skin wounds is not related to how the drug is, what route of administration. So like I said, you can get the skin wounds from smoking or snorting the substance. And we really don't understand why xylazine is causing the skin wounds. Like on a cellular level, they're really not sure what's going on. Because it's so new, we just really need more research. I was recently in a webinar with a pharmacist at University of Houston or University of Austin, and they are starting some studies on this. So hopefully we'll have some answers soon, but really all we have is anecdotal evidence, and we really don't know what's going on. That's why it's kind of so scary and something that we're trying to kind of get ahead of. Is it possible to use the strips to test marijuana? So you could, in theory, do that. You do have to mix the substance with water in order to test it. And then the other thing I'll say is we really aren't seeing evidence that there is fentanyl or xylazine in marijuana. I think there has been one confirmed case out of one medical examiner's office in Baltimore, maybe, don't quote me on that, but that's another thing that we kind of are seeing as a myth that's being perpetuated. It doesn't really make a lot of sense to add fentanyl to marijuana. Fentanyl costs more than marijuana. It provides different effects. Additionally, fentanyl becomes inactive at high temperatures. So once you kind of light it on fire to light the marijuana, it becomes inactive. So this is something we're really seeing more as myth than fact at this time. That being said, if someone really is concerned about it, they could, in theory, use the test strips on marijuana. Oh, someone interested in the vending machine. Awesome. Let's chat. I'll put my email in the chat when I'm done answering questions. Yes, I can. We'll share out the language guide. We're going to share the PowerPoint, and you'll be able to click through to that link. But just in the meantime, the organization is called Shatterproof. What was stigma number 1 for? Stigma was the number one reason, number one barrier for accessing treatment. Will Suffolk County be getting a vending machine? Unfortunately, we don't have any vending machines in Long Island. So if you know of any partners that are interested, let us know. Additionally, this is our first round of the vending machine project. We're hoping to get renewed for a second round. So if you don't get one this time around, definitely join our mailing list and we'll let you know if/when we have more vending machines available. Do you provide naloxone as well through the app website? Unfortunately, we don't have funds to ship naloxone at this time. But if you go to the Oasis website, you can request naloxone and it'll be fulfilled through Next Distro, or you can go to Next Distro directly. If you go through Next Distro directly, it is a little more involved of an order form. So the Oasis form is pretty low barrier. They do ship to individuals. I'm not exactly sure if they're sending kind of bulk orders of naloxone at an organizational level. But you can definitely reach out to them. And if not, if you are looking for organizational, like a high volume of naloxone, I definitely recommend becoming an OOPP, an overdose prevention program through the State Department of Health. We have a really helpful contact there and always happy to help support people in becoming an OOPP. If that's something we can support you on, definitely reach out. We will definitely be sharing a copy of the presentation. What are test strips used for? So test strips are used to test a substance before you use it. So you can make an informed decision on if you want to use it, what's in the drug. I will say that test strips test for the presence of a substance, but not the potency. So you'll be able to know if there's fentanyl in it, but you won't know how much fentanyl is in it. Thank you for dropping your email. What all is dispensed in the harm reduction vending machines? So right now they've been configured just for the boxes of naloxone, that the Narcan, and then 10 packets, individual packets of 10 of the testing strips. We are in the process of becoming a syringe service program. And so once we are approved for that, we would really love to have safe injection kits and safe smoking kits available in the vending machine. That being said, that's a whole nother kind of community buy-in process that we have to get the approval of stakeholders in the community. So that may or may not happen, but that is ultimately our vision. But right now it's just Narcan and testing strips. How can we organize a training on naloxone administration for our organization? So we do Narcan trainings, and we can do them virtually. But like I said, unfortunately, we wouldn't be able to provide that naloxone. So depending on where you are, we have a list of, since we are across the state, we have partner organizations everywhere. So there might be an organization that we can connect you with locally that would be able to come in person and provide the training, as well as actually give you the doses of the naloxone. Is there a cost for the HR vending machine? There is not, and so it is part of a grant. The organization can either pay for it up front and we reimburse you, or you can go through this purchase order process where we would still cut you a check ahead of time. So the only cost that you would have would be the ongoing electricity bill. Even if there's not an outlet, we do cover the cost of installing electricity. It's just that ongoing electricity bill that would be the only associated cost. I had read in one of the Xylazine info sheets, I found that snorting led to fewer skin wounds than injection. Is that not accurate then? That could be entirely accurate. I will say that, from a lot of the stuff that I've seen, we are getting a lot of conflicting information. I guess it would definitely make sense that, the site of the injection, you're more likely to get a wound, and that could be just like an injection related wound and maybe not a Xylazine related wound. There's a lot that's kind of unknown, a lot of complicating factors in the whole situation. I would like to know, is this only on Zoom or do the organization offer in-person services? We do offer in-person services. We are based out of Buffalo, New York. We do travel quite often. So depending on kind of how many people are interested or what exactly you're interested in, we may be able to connect with you directly or refer you to one of our partner organizations. In the follow-up, I can send information on getting a harm reduction vending machine as well. What criteria is used for where the vending machines are placed in the city? We are looking for places, that are high need. We do ask that all the vending machines be placed outside so they are accessible 24/7. Other than that, there really isn't too much criteria. We don't want to put one right next door to another one. So we just want to make sure that, we're having the most impact as possible. I've heard of people adding fentanyl and alcohol. Is that possible? That's not something that I've heard of. I guess it technically could be possible. It doesn't seem like a very likely or probable scenario. Are the vending machines free to receive products from? Yes. So individuals who go up to a vending machine, they have to enter in their year of birth in order to access the products, but everything that they receive from the vending machine is free. Are test strips used for testing someone who is currently alert or for someone who is currently non-alert? So the test strips are used for testing a substance before you use it. So it's usually for the individual who's using drugs, will test their substance themselves. So I would say, it's for someone who is currently alert. We answered about getting trained for naloxone. We are going to get you more information on expired fentanyl test strips. I can send that in the follow-up as well. There are test strips in Brooklyn. I can also send out a link to all of our partners. But I do know that the New York City Department of Health and Mental Hygiene has a pretty robust test strip distribution program. So I can let you know exactly where those are located. There's a lot of questions here. I don't think we're going to get through all of them. I think I thought I saw someone drop my email in the chat, but if not, I'm going to drop my email in the chat, and please feel free to reach out to me directly
as we go along.
Sorry, Bridget, what was that?
I've been trying to answer some as well, and I can also send your email in as well.
Cool.
Okay. Do you think are you done answering questions, or are you still gonna try and answer a few more?
I think I read through a lot of the ones that are left. There are a lot of repeat questions or just
Okay, that's what I thought.
individualized ones. Yeah.
Okay, great. So I just want to give a huge thank you to Bridget and Shelby. This was fantastic. This was so informative, and someone put in their question, the most informative presentation they have attended. We have 230 folks on, and we will be, we've recorded this, we'll be posting it on our website, we'll be sharing it out, we'll be sending the slides to attendees, to our wider community, folks who weren't able to join today. So you'll get that information, and then we'll be sending out both of your emails since you've volunteered, and so folks can follow up with questions, more information on the vending machines, more information on Matters services. So thank you everyone for attending, for joining us. And thank you again, huge thank you, Bridget and Shelby. We so appreciate you joining us. This was so important. So we will end now and be following up with more information. So thanks all.